Our speaker is Ms. Deena McCollum, who is a registered nurse from Texas. She's been there for 22 years, has experience in acute hospital care, rehab, and long-term care, and has had leadership positions, being team leader and also very much concerned about nurse advocacy. And this is really where she's kind of risen to fame. Deena is currently involved in multiple patient safety initiatives, which has included a National Medical Malpractice Advocacy Conference, a compassionate care video presentation with a large healthcare organization in San Antonio, and she's also been involved in Patient Safety Week. And what I think is most important, which brought her to our attention, is her involvement in organizing and participating with the rally for the nurse to have adequate nurse-to-patient ratios. And so at this time, let me turn the program over to Ms. McCollum.
Thank you, everybody, for joining this evening, and thank you to Kevin for allowing me this opportunity. As he mentioned, I've been a nurse for 22 years here in Texas and done director roles for 10 years, and after 10 years of bedside, and I recently went back to the bedside. And the year 2014 was a definite roller coaster ride through healthcare my family never dreamed we would be a part of. My dad was 72. He was admitted on New Year's Day for possible infection of hardware to his knee. He had already had it replaced 2 times prior. So we knew if it was infected again, this wasn't going to be a good situation. But admitted on New Year's Day, did a procedure to try to clean it out and see what was going on. And before the procedure, he had reminded his orthopedic surgeon that had been his surgeon since the late 90s that he developed ileus easily with the other procedures, and just wanted them to be aware of that. And the surgeon said, I think that it's the length of the surgery, not the medication that anesthesia uses, but we'll look into it. So he felt comfortable that everything's going to turn out okay. Well, within 36 hours, he started to show signs of developing an ileus, and we let the staff know what his history had been, and they said, no, he's passing gas, and he wouldn't be doing that if he had an ileus. They didn't see a need for any follow-up testing, and we persisted, and finally they did order KUB that was done probably noon on a Saturday. By 5:30 or 6, my dad was getting even more uncomfortable. Stomach was getting largely distended, and so I kept checking with them every hour or so to find out about the results of the KUB. And finally, 7:30 that night, the nurse said yes, the KUB was back and there was a small ileus, and they would be calling the orthopedic surgeon to get an NG tube order and such. And so I let my mom know that. Of course, I'm thinking in my head, we're already so far behind the curve. We had to be persistent for 12 hours to get them to even order the KUB and do it. So I told my mom I'd be there early the next morning to check on him. I live in Hondo, which is 40 miles from the hospital where my dad was at. We live out of town, as do my parents. And that morning I was woken up by a horrible call from my mom, and the fear in her voice I just will never forget. She said, something's wrong with Daddy. There's people all over the room. I don't know what's going on. And I said, is he talking to you? And she said, yes. And I said, did they say the words rapid response? And she said, yes. And so got on the road to get in there. And when I got in there, I could just tell by looking at him he was in hypovolemic shock. And I asked the nurse what happened. And she said, well, he started having projectile vomiting. And I said, hold on, if we did an NG tube, why did he have projectile vomiting? And she said, well, we didn't get the NG tube put in until 5 in the morning. So I'm thinking, okay, so we had the results at 7:30 last night, discussed putting an NG tube in, and now we're at 5 in the morning when he's having projectile vomiting. After I received my dad's medical records, I realized that, in fact, what my mom said happened was true. They didn't put the NG tube in until after my dad had the projectile vomiting, so he had gone all night decompensating. So sent him to the ICU. By then we're adding cardiology, nephrology, gastroenterology. We're adding all these other specialists because of the delay. He was having abnormal heartbeats. His kidneys took a hit, and so added specialists. So now we're at 5 specialists on the case. He got better, seemed to be improving, and they sent him out to a telemetry floor. And within 24, 48 hours on the telemetry floor, something just didn't seem right to me. Something about him didn't look right. And so I told the nurse, I said, I live an hour away. This is what's happened over the past week. I'm concerned something just doesn't seem right. Even though my mom is staying with my dad, can you call me if anything at all happens because I want to be here? And she was like, sure, no problem. I'm sure everything will be fine. Well, I woke up the next morning to get in to see my dad before I had to go to work, and there was a message on my text message from my mom, and she said, Daddy had a bad night. Fever spiked at 3, weren't able to get the fever under control or his breathing. So they've requested an ICU bed, and he'll be going back to ICU. So, again, 40-minute drive into San Antonio. And when I got there, the nurse was at the desk, and I said, we had talked last night. I asked you to call me if something wasn't right with my dad, and now we're needing an ICU bed. I was just wondering why you didn't call me at 3 in the morning whenever he spiked the fever, even after that when y'all couldn't get it under control. And she said, I didn't have time to call you. I've been calling your dad's doctors all night. So I went into the room, and I just could tell right away that he needed to be intubated. Respirations were probably 40 to 50 a minute, and I couldn't tell if he looked at me, but I could tell that maybe he was kind of in and out of confusion. And so I went back out, and I asked her, did y'all call a rapid response? And she said, no, we don't call a rapid response when they're waiting for an ICU bed. And being a nurse, I knew that that wasn't true. And I said, you need to call a rapid response so the people that need to be here can be here to keep him alive until you get an ICU bed, because we're knocking on 5 hours that we've been waiting for an ICU bed, because that was 3 in the morning, and now we're at 8 o'clock around there. And so she called the rapid response, and the pulmonologist that arrived, I'll never forget the words out of his mouth. He said, oh, my God, this man's going to die if we don't get him to ICU right now. And the pulmonologist called the chief nursing officer and said, you've got to find a bed for this man. He's going to die if we don't move him up. And come to find out, there were 5 other people waiting for ICU beds, and my dad was just another name on the list. Got him up to ICU, and ultimately he did have to be intubated. So we had gone from ICU, possibly a BiPAP, to ICU, intubation, CRRT, because his kidneys weren't functioning at all. Every medication you could imagine to keep his blood pressure up. Levophed, which anybody in healthcare knows, Levophed, leave him dead. He, his feet were turning black, his hands were turning black. And we knew, the cardiologist told us, I don't know that he'll make it through 24 hours. Well, this was his second rapid response, and transferred to the ICU in less than 6 days. By 24 hours, somehow, just honestly, miraculously, he just turned around and everything started improving. Hands and feet turned back to beautiful color, and he was extubated and up in a chair within 72 hours of the incident, which was how my dad was. He just was a really strong man. After that, was discharged ultimately on, I believe, day 36. So a hospital stay that was supposed to be 3 or 4 days ended up being 36 days because of the delay. And when he was in ICU the second time, when they had to intubate and he got put on CRRT, I knew that the hospital system used the Muse scoring system for early warning sepsis, because I had worked for the organization a year prior. And so I started plugging my dad's vital signs, because my mom always took notes, and I started plugging the vital signs into the Muse scoring system. And his Muse score was like a 10. By the time they finally transferred him to ICU, I didn't even know the scale went that high. Back whenever I had told the nurse, I feel like something's not right with my dad, his Muse score was 3 to 4, which the score indicates at that point you would call a rapid response, which hadn't been done and wasn't done for another 12 hours, I believe. So discharged, went home, seemed to be improving. Ultimately, we did have to amputate the leg. This was late summer, July. We were supposed to arrive at 7. He would go into surgery shortly after that, after the admission process. Well, by noon, we hadn't heard anything. Nobody had told us anything other than the admission process. We hadn't seen any other staff, and so my mom asked the nurse, what's the delay? And she said, oh, there's just other cases. My dad had FSA of the wound, so we knew he had to be the last case in that OR room for the day, just for infection control purposes. But we were under the impression it was going to be 12 or 1, something like that. He didn't go into the OR until he went into pre-op at 7 that night. It didn't go into OR until 9. And no communication the whole time as to what the delay was or anything. We found out in pre-op when my dad voiced his displeasure to the orthopedic surgeon and the anesthesiologist about being MPO almost 24 hours and no communication. And The orthopedic surgeon said, I told the pre-op nurse to call the floor and tell them that I had an emergency at another hospital and your case was going to be delayed. Well, that call never occurred. The pre-op nurse never called the floor to let us know that. And of course, we, voiced concern, and they put my dad up in a really nice room and gave my mom a nice bed for the next couple of days because we had complained. But so he was doing well. Amputation was done. We were working on getting the prosthetic leg. We had a company lined up that was going to move the gas pedal. It was his right leg, so a company lined up that was going to move the gas pedal from the right side of the truck to the left because he was still working full-time up until all of this happened, and he was just determined he was going to go back. So we had pretty much everything lined up. Our goal was that he would walk at Christmas. Thanksgiving Day, whenever they got home, we had been at my aunt's house, and whenever he got home from the day, my mom called me and said that he was running fever, and he had had cough congestion over the last week or so. He would periodically have to get blood transfusions and iron infusions as a result of the kidney failure or the kidney damage that occurred back in January. He was ultimately able to get off dialysis, but still was having to receive blood transfusions every other month or so and then iron infusions. So just 2 days prior to Thanksgiving, he had received 2 units of blood on an outpatient basis. And he had cough and stuff, and so his doctor said, just take him to the hospital, we'll admit him, probably has pneumonia. And that's what the ER doctor said. He admitted him for possible pneumonia. And by the second day, when we rotated shifts, we never left him alone. He was alert and oriented, but with all the things that had happened, we never ever left him alone. So he just looked dead to me. Unfortunately, I'd seen enough dead bodies that when I walked in, I was like, oh my God, his color's horrible. And his stomach was hugely distended. So I went out to the nurse and I asked her, he doesn't look good to me at all. And she said, well, we're having to give him blood. His H&H were low. And I said, okay, he had 2 units of blood just 3 days ago. And his stomach is big. It's bigger than usual. And she said, well, I wanted to ask him, but I didn't want to offend him. And I said, you need to take the risk of offending him. This is not normal. And I told her at that time, this was the Saturday after Thanksgiving at noon, I said, I think he is in congestive heart failure. 15 of my 20 years of nursing was telemetry and heart transplant heart failure. So I said, I think he's in heart failure and he's retaining the fluid in his abdomen. And she said, I said, we need to call his cardiologist and start looking at that avenue. And she said, okay, well, we'll call. And I said, he had this 2 units of blood, and now we're giving him another. This is a lot of volume just in 3 or 4 days if it is his heart. And so she said she would look into consulting the cardiologist. I stayed with him until that afternoon, and then my mom came back in from being home, and I went on home. Well, at midnight, my mom called, and she said that he started running fever about 8:30, and she said the hospitalist had been by about 5:30, said he looked good, he was probably going to go home the next day. But she said something changed with him at 8:30. He started running fever, and she said something changed in his breathing. I could not put my finger on it, but I told the nurse that somebody needed to come back and look at him. A doctor needed to come back and look at him. And my mom said the nurse just said, no, he's, we're communicating with the doctor. We've put him on oxygen. We're doing these different things. And my mom was persistent. Well, when she called me at midnight, she said, Deena, now I'm begging them. I am begging them to have a doctor come look at Daddy. Something's not right. I talked to him. He was talking, he was alert and oriented talking. I could tell he was winded. And so I talked to the nurse. I talked to the house supervisor, charge nurse, and I said, my dad will look fine to you. He'll be alert and oriented and look fine. And you'll turn around to go give a pain med to somebody, and he will crump, and you'll call a rapid response. I'm telling you, he needs to go to a higher level of care. And if my mom tells you something's not right with my dad, something's not right. They've been married 49 years. And they said no, they didn't have reason to move him to a higher level of care. They were keeping in communication with the doctor. And I said, did the cardiologist get called? And they said, no, the internal med doc said he'd call him in the morning. And I said, I don't think my dad will live till morning. I truly believe he's in congestive heart failure and it's not pneumonia. So we were persistent. And unfortunately, and slightly embarrassing to say, I told the house supervisor finally after 2 hours on the phone with her, I said, if you don't move him, I'm going to call the CEO and I'm going to call a lawyer because my dad needs a higher level of care. Well, within 15 minutes, the cardiologist is on the case, and my dad's getting moved to the ICU bed. And I told my mom I was just going to shut my eyes for 20 minutes, but that everything was moving in the right direction, and for her to call me when he got to the ICU because I wanted to talk to the ICU nurse about my dad's history. And so she said, okay. Well, I hadn't even closed my eyes, and the phone rang, and it was my mom again, and she was hysterical. And she said they didn't even get Daddy off the elevator. His blood pressure dropped. They had to call rapid response again, and so raced into town, of course, 40 miles away again. And when I got there, the house supervisor was in the waiting area of the ICU with my mom, and I asked her, I said, what did I tell you was going to happen if you didn't move my dad to a higher level of care? And she said, well, we never could have anticipated this. I said, yes, you could have. You know, from 8:30 to midnight when my mom was telling you something wasn't right about him, and then when you and I were talking from midnight to 2 o'clock, you wouldn't have moved him if I hadn't threatened to call CEO or lawyer. And now he needs to be intubated. And so I went in and I told my dad, you know, they're going to have to intubate you again. And his experience in January was horrible. He remembered all of it. He remembered the tube, just horrible memories from it that he had shared with me. And so I wanted to give him the option to say no if he didn't want it to be done again. So I told him they needed to intubate him again and if that was okay. And he said, well, what's my alternative? And I said, there is none. So they ultimately intubated him and were never able to get his blood pressure up enough or even stable enough to put him on CRRT. None of the blood pressure medicines were working. His heart rate was 20s, 130s, wouldn't come down for anything, no matter what they tried. So at 9 that night, I visited with the cardiologist, and he said, you know, he's just not responding to anything, and he started having abnormal heartbeats, PVCs and stuff in the night, and he said, I'm really afraid that he's going to code, and we're going to have to code him, and I knew that he couldn't live through that, and so explained it to my mom and my sister, and I was the medical power of attorney, so I made him a DNR. But I said, let's not stop anything. We don't have to titrate meds anymore. We can just leave them as be just for a while. Let me see what he does. I'm not ready to completely give up. And that old Pollock just trucked on along for 7 more hours from 10 in the morning to 5. He just sat there with a 70 over nothing blood pressure and heart rate in the 150s. And so I sat down with the nurse and went over everything that they had tried, and ultimately there was nothing else we could do. And I truly feel that my dad knew that if I was leaving everything on him, that I felt that there was a chance that he could make it and he was going to fight if I felt there was a fight. And so we took everything off, left the ventilator and the sedation so that he wouldn't struggle, or that my mom wouldn't see him struggle for air, and just sat by his head and told him, you know, that he needed to stop fighting, that whole conversation. So after my dad died, I had seen so many missed opportunities. I mean, he had been in a hospital over the 11 months, 100 days. He had 15 surgeries, was on 11 different floors. So these were trends in this hospital. These were trends in nursing care that I had noticed. So many missed opportunities, and I committed to going back to bedside nursing. I had not been in bedside for 10 years, still paper charting when I had been in bedside, so went back to bedside nursing because I just had to know, did they not care about my dad, or what were the reasons for all of the errors that occurred to this one man I felt didn't deserve any of it. So went back to bedside last June, and just within months, I could tell that the expectations on the bedside nurse now, as opposed to 10 years ago when I had been at the bedside, were just so unrealistic and so dangerous. I truly felt horrible that I had even thought for a minute that the nurses didn't care for my dad, because I now was in their position, and I'm just still to this day, I feel like I'm just trying to keep people alive. You know, I'm looking at my patient assignment of 7 to 8 patients, and I'm thinking which one is the closest to being unstable, and that's the patient that's going to get the majority of my time. And unfortunately, the one that's fixing to go home in a day or two is going to get the least amount of my time, which is not how I was trained as a nurse. So that's really what's got me into trying to push for safe patient ratios. Like last October, Pam Barcombe an RN from South Carolina reached out to a couple of us and from a Facebook page, Nurses for National Patient Ratios, and said, that she was looking to do something bigger to really move this forward, and was this something I was interested in being a part of. And it was perfect timing with my dad and me wanting to make a positive change to try to give purpose to his pain. And so became the rally, which is May 12th in D.C., for pushing to mandate. There's 2 bills that have been out there just kind of sitting in the queue, I guess. S-864 is Barbara Boxer, and then H.R. 1602 is Jan Schakowsky. And they've been pushing these bills, Barbara Boxer, since 93, I believe, no, since 04. And so these bills are actually out there just waiting to be looked at. Again, they're in committee, and that's what the rally's about, is just bringing awareness to people about the unsafe situation that's occurring in healthcare today and the need to do something about it. It's clear that the public, myself, I had been a nurse for 22 years, and I had no idea that it was the 3rd leading cause of death until this happened to my dad. So that's kind of my direction, my motivation right now. When I was reading through Health Watch USA's mission, and when I read to promote quality health care through assurance of adequate nursing staff, my heart just sank, because I thought, that's what it's all about. I knew I could see the things that the nurses just never had an opportunity to do. The KUB results for my dad, you have to dig into the computer to get those. Back in the paper charting days, those results are spitting out on the printer, and you've got a unit clerk handing them to you. Well, they don't anymore, so they're hidden in the computer. The Muse scoring system, the computer system figures it for you, the score, but you have to dig for it. And if you don't have the time to dig for it, then you don't know that their Muse score is increasing. And when you have 7 or 8 patients, the likelihood that you're able to go digging to look for information is minimal. So absolutely having adequate staff and qualified staff is key. So I appreciate what Health Watch USA is doing.